Immunization is key in preventing illness and sometimes death associated with vaccine-preventable diseases. New Hampshire has been very successful, though, in achieving improvements with childhood vaccination rates. However, our success is not nearly as good with adult vaccines. New Hampshire state epidemiologist Dr. Ben Chan joins us now to discuss this important topic. Dr. Chan, what can we do to improve these adult vaccination rates?
Well, thank you for having me. And let me start by saying that high vaccination rates are one of the best ways that we have to protect our own individual health, as well as the health of those in our community and our friends and family around us. The vaccination rates have become very complicated over the last few years, so it's important for people to talk with their healthcare provider to see what vaccine might be right for them or recommended for them. The recommendations are based on age, sometimes certain medical conditions. There may be medical conditions that prevent you from getting certain vaccines, so it's important to check with your healthcare provider. Vaccines are one of the most effective ways and one of the most effective tools that we have to prevent spread of infection and illness.
Tell us what specific vaccines adults should be looking at renewing or getting. What are the ones that they need to get?
Yeah, so there are a number of them. Off the top of my head, tetanus is an immunization that adults should get at least every 10 years. There are pertussis vaccines, or whooping cough, that has been combined with the tetanus vaccine called the Tdap vaccine. That's recommended a single dose for all adults. And in fact, pregnant women should get a dose of this vaccine every time they're pregnant. There's the pneumococcal vaccine, which prevents serious or invasive bacterial infections with the Streptococcus pneumonia bacteria. There are two different vaccines, and that's recommended for adults 65 and older, as well as certain younger individuals who may have underlying medical conditions. There are the human papillomavirus vaccine for young men and women is recommended to prevent cervical cancer. There's a shingles vaccine in people 60 years old and older to prevent shingles. And of course, there's influenza that people should get every year.
We know flu season is just around the corner here. Is there anything someone should do specifically to deal with that here heading into that time period?
Well, vaccine is still the best way to prevent influenza, and anybody 6 months of age and older is recommended to get the flu vaccine. Certain people should most certainly get it. Those are people that are at high risk for complications from flu, the elderly, people with compromised immune systems, people with chronic medical conditions like heart and lung disease. Certainly healthcare providers or those caring for individuals that are at high risk should also get it.
Quickly, Dr. Chan, if I'm a low-income person who doesn't regularly see a doctor, where can I go to get these vaccines?
I would suggest talking with your healthcare provider. There are some community initiatives to, for example, immunize people for influenza, so influenza vaccine could be free this year. But I know that there are community resources out there, and probably the best person to check with would be the healthcare provider.
All right. Dr. Chan, thank you so much for your time.
Thank you.
Much appreciated.